Introduction about myself. Good afternoon to all of you. I am Ashish Jain, founder CEO of Medgini. It's an organization we established in 2012 with the whole objective of helping pharma companies and healthcare companies to connect with doctors, chemists, and patients. I have done my MBA in marketing communication from Symbiosis Institute of Business Management in 2004. And I had the privilege and the opportunity to work across various sectors, including IT, telecom in India, Middle East, and Africa. In 2021, I was humbled to be recognized by Business World 40 Under 40 Healthcare Power List. So beyond work, I really enjoy cycling, dancing, and reading. Most importantly, I cherish my time with my parents, wife, and two sons based in Hyderabad, who keep me grounded and motivated. I'm delighted here to be the host for today's webinar and will be sharing my knowledge and learning from all of you today. Thank you so much for being with us today. So with that, we are here to welcome our main speaker for today's session. Our speaker today has remarkable journey in the pharmaceutical industry with 35 years of experiences. Starting his career as a medical rep, he rose through the ranks by taking a diverse responsibility across sales, marketing, business development, commercial operations, and strategic leadership. His journey is a testament to the power of continuous learning, perseverance, and excellence. Academically, he holds a master in marketing management from Wellinger Institute of Management and has consistently invested in expanding his knowledge and skills throughout his career. What makes Sriram sir truly unique is his passion for science, marketing, and technology, a combination that has helped him bring fresh perspective to business and leadership roles for whatever he has served till date. Beyond his professional accomplishment, he enjoys singing, photography, painting, writing, karate, and reading. Please join me in welcoming a respected industry leader, lifelong learner, and inspiring professional, Mr. Sriram Balasubramaniam sir from Mumbai. Welcome, sir.
Thank you so much, Ashish.
Yeah.
Really a pleasure.
So, anything we are missing from the introduction, please excuse us. And if you like
No,
to
no,
add
I
something.
think it's a wonderful introduction. You know, people know me, and that's sufficient enough. If I keep on contributing and learning, I think that I'm happy about it.
Thank you so much, sir. And with that, we'd like to give you an introduction about this particular topic and how this topic has germinated. So every session that we do, we definitely take feedback from our participants, our community of pharma marketeers to whom we service. We also keep them updated, and we also hear from them in terms of their needs, challenges, problems, and aspiration. So always as an agency, when we serve pharma companies, the first question and the question which keeps hearing every time in every meeting is, what is the ROI for this campaign? So that really has become a topic of interest to my team, who has really deep dive to find a relevant speaker who can value out on this particular subject. And I have been knowing Sriram sir for more than 12 years now, and had the privilege of working across various campaigns, learning many things in pharma marketing while we have been serving him in his position. And today's session, while my team was doing a research, we thought that the session has to be divided into three parts. One is segmentation, targeting, and positioning. When we're talking about segmentation, the key area of concern is to reach out to the right set of audience. When we are talking about targeting, are we having the right resources to be targeted to our target audience, which is doctors or regions or customer segmentations? Positioning is all about the communication, how exactly we are differentiating ourselves from our competitor. We are in the industry where there are a lot of Me Too products, Me Too brands, and the share of wallet and the share of mind is very, very critical for all of us as pharma marketeers. So keeping that in mind, we have crafted this particular webinar, which is of interest and which is of concern to all of us in the industry. So the one question which I would like to ask the participants who have joined us today is, are your pharma campaigns creating real impact? What we mean by impact is your brand has reached thousands of doctors every month with the help of the medical rep as well as the effective campaigns that you have crafted. How many interactions actually influenced prescription, loyalty, and growth? I would appreciate everyone to respond in the chat in terms of how has been the impact of your campaigns to your target audience. Please be active in the chat and also keep as many notes as possible so that you take this learning back home. It is no theory session, and we have just kept the PPT to have a flow on the entire webinar. Otherwise, it is going to be purely interactive, and Sriram sir will be sharing his experiences spanning across building brands across his career, working with doctors, being on the field. So, how has been your experiences? I would like to hear from you. Mr. Bharat says that he is effective from understanding the doctor pain points and making inputs for better adherence. Wonderful. That point is relevant. And Tanmay says, yes, however, measurement of the same is not structured. Perfect. So that's the area of concern for many of us as pharma marketeers. And Shweta says, not a desired, but execution is a big challenge. Yes. So things are ideated, but execution becomes a challenge, is what Shwetam says. And we are talking about Hemang up to certain extent. Nisar says that up to some extent. So some people have concerns about the execution of the campaigns which are crafted. So this is the self-audit activity which we were talking about, which was crafted with the help of our speaker. It is consisting of 10 questions, which talks about how we actually do the work when it comes to ROI in various campaigns in terms of selection of data. So we have made it very simple for you. You can scan this particular QR code, participate in this self-audit activity, get a score for yourself, and understand where do you stand so that you can also improve on things where you're lacking. So this particular thing has been crafted with about 15, 20 days of thorough process, taking feedbacks from various pharma marketeers, understanding what are the activities which are relevant, which are important, which are measurable. So please do participate. It definitely is going to be a good learning experience to all of you. I would appreciate, please scan the QR code. You have any difficulty to scan the QR code, my team has put the link in the chat. Surya, can you please put the link in the chat? Yeah, so we have 5 minutes because this is going to be thought-provoking and this is also going to be useful for your business. Please do participate. And this session is not going to be another session. This will definitely change the way you are doing things and give a new perspective about how to do things right. What are the things that we normally need to avoid? And definitely there are two winners which will be announcing end of the session who will be getting a book, which is Advertising in the Age of Generative AI. We're all talking about AI and their influence, the impact. And we all work with agencies as pharma marketeers, and they are definitely ways and means you can improve your work. And this special book, which is going to be released 2 weeks from now, is from Dr. Subbarao, and he's a renowned author in the domain of pharma marketing. And this particular book will make a lot of sense to you. It's a practical workbook, and this is a practical paper book that we will be delivering to the winners. End of the session, we'll be taking your address. The two winners will be getting this particular book from our side. So are you excited? Please type in excited. And with that, we also allow my team to, you can click on the link, which is put in the chat, and participate in the self-audit activity, which is for ROI in pharma marketing. Once you are done, please type in done so that we can move on. There is a lot of valuable things that we are going to share today in the session, which is cutting across segmentation, targeting, and positioning. And we have our speaker who is going to talk with his experience, practical things which really matters when it comes to ROI in pharma marketing. So irrespective of the role that you have in pharma marketing, this is the topic which you will keep hearing from your seniors. All are very concerned about the ROI in pharma marketing. Yes, we have got 5 confirmation on the chat. At the back end, the dashboard says that about 20 people have participated. Yeah. So yes, so please put in done if you are done in the chat. Bharat, thank you. Thank you, Bhaskar. Thank you, Shiva. Thank you, Tanmay. Right. Perfect. So with that, I would encourage all of you to please participate, please move on and help us take this session forward. So the first topic which we are going to discuss with our speaker, Sriram Balasubramanian sir, is segmentation. So Sriram sir, we have seen in pharma marketing, having worked across various companies, various brands, the key concern is that every rupee that is going to be spent in pharma marketing has to be spent in the right direction. So how can pharma brands identify which doctors, regions, and campaign are truly driving growth? Because it is not money in the well, it is the money which really matters. So, Sriram sir, with your experience, can you give us your perspective in terms of how can pharma brands identify which doctors, regions, and campaigns drive growth?
So to start with a little preamble before I, get to the context, very important thing is that when marketing people join marketing in companies, they think that they are responsible for market building. But what is very important is that every organization, whether it's a people starting from the lowest level to the highest level, starting even from a medical rep to sales managers to product executives or product managers, the company is deploying huge amount of resources into their hands. That means they are financial managers and not just marketing managers or sales managers or sales executives or representatives. Because if you were to look at it, sum total of spend which is done on each head, the sum total of spend that is given to the brand managers to handle and the resources that are given to them, they're actually financial managers, because at the end of the day, with the finances which are deployed by the company, they have to give the outcome which the company desires in terms of the ROI. So once this realization is there that I am responsible for the money, automatically everybody starts aligning marketing to finance. Otherwise, we will always remain as I have done this activity, I have done it creatively, but that responsibility towards financial outcome is the balance that we need to bring in. That's the preamble to it. Now, why are we talking about campaigns, and how are we talking and trying to get into the segmentation? So campaigns are most important part of your spend, because though you may prepare a marketing budget, the marketing budget has different headings. Like you've got a print material, you've got samples, you've got gifts, you've got other resources which that is tabletop reminders which you call, or other activities that your scientific engagement that you're trying to do. However, from the point of view of the direct doctor engagement, okay, the spend is maximum during a campaign phase, okay, where your not only your time, energy, but also your monetary resources are much higher compared to the non-campaign activities which are taking place in the company. So hence, it is very important that there is a proper ROI. So when we talk about segmentation, before the segmentation, you have to prepare for it. Okay, according to me, every campaign requires preparatory work. So generally, my experience has been that we start do a brand plans generally before the budgeting in every year, and in that phase that we are doing, we don't fix all our campaigns correctly. Campaign is a subset of your brand life cycle. Okay, it's a part of what you want to do with your brand positioning, with your brand communication, with your brand growth strategy for the year. And if that is not fixed at this beginning of brand plan, then when you come to actually executing the campaigns during the year, okay, and you abruptly start entering a campaign, you are not well prepared. So preparatory work starts with the design of the campaign, starts by aligning the campaign to your brand, what you call as strategy. Not only aligning it, ensuring that you have already thought of a lot of things at the brand plan stage. And then when you come to the campaign stage, you start the campaign phase well in advance, because that means that you are explaining the design. Most of the time, we are communicating and telling people what to do. But campaign requires a lot of buy-in. We have to buy in people so that the execution becomes much better. Obviously, you're in any company, the campaign effectiveness can vary. But the campaign effectiveness varies based on, traditional strengths which are there in the company. But you don't want to only work on the traditional strengths. You also want to see that there are, areas of excellence which are improved. For example, let us say a company has very strong in south of the country, and they are, predominantly very strong in Andhra, say
Sure.
Karnataka, maybe in Maharashtra. But the objective of the brand managers campaign is to not only to bring more uniformity in the marketing activities. So hence, if you only want your campaigns to succeed, or you think that your campaigns are succeeding only in the areas where you have strengths, that means my campaign is not been effectively designed, it has not been effectively primed and effectively communicated. Because at the end of the day, in your brand strategy, already you have got your doctor segments identified. You have got your regional strengths which have been identified. You have decided the objective for this year is that I want to improve my presence in the following segment of
Yeah.
specialty, in the following indications, in the following usage areas, in the following. So you've already done your demographics well in advance.
True.
The campaign alignment towards the demographic needs a lot of buying. So people, when they think they want to execute a campaign, should be working at least 1 month in advance before the campaign starts,
Yeah.
by priming the what do you call as the areas or regions where they want the growth to come in. Their
Perfect.
focus of the brand should be that, okay, how do I prime them? How do I buy them in? How do the preparatory work be done? So that when the campaign is actually carried out,
Hmm.
people are well aligned and realize the importance of the campaign,
True.
okay, and what they can contribute because of the effectiveness of the campaign.
Absolutely.
So, secondly, the campaign duration is generally measured very, very quickly in many companies. They think that the campaign is over within the month of whatever the campaign is carried out. But consumer behavior or the impact of the campaign, okay, takes some time for the conversion cycle to actually hit it. So the control and monitoring, okay. So there is as we talk about it, there is a preparatory phase, there is an execution phase, and there is a follow-up phase. So any campaign, according to me, has a 90-day bandwidth minimum. Okay.
Perfect.
And in that 90 days, 60 days are the period in which you start being able to see how the effectiveness of the campaign is there. And the learnings of the campaign should be quickly collected. So the corrections are brought into the next campaign that you want to execute. Because campaign is like a wave. You're not going to just shut a campaign because you've done one and then it has partially worked or not.
Perfect.
Secondly, I think all these campaigns need to be integrated into the SFE, because SFE already sits with the data.
Yeah.
So the data of, to the last mile effectiveness, who is the most effective rep, which are the, you know, what do you call this, effectiveness of the field force in various regions, in various segments, with various set of doctors. Okay, you already have this data sitting.
True.
So the more finer you pick up the data for campaign preparation from the SFE, the more effectively you'll be able to monitor it
Yeah.
during execution.
Perfect.
So let us say, for example, standard campaign will be that we need to do a campaign for a brand. Okay, these are the resources that I'm going to give. These are the activities that would be carried out. And there is a standard list of say 10, 15 doctors on which that will be carried out. Okay. However, in that same phase, if you were to narrow down, okay, and say that, okay, out of these are the doctors which are there already in my list, okay, which are either to give me a brand return, but I can optimize the return much better because it is mapped into a recipe. You're picking up that data, okay. And this can be done by companies which have got, digital resource and non-digital resource. Both can have this resource. And
Perfect.
we come in the era where you used to do it on pen and paper. Today,
Hmm.
you have the digital resources sitting at your end. So
True.
in these areas also, you can actually prepare and say out of these 15 doctors, okay,
Hmm.
which are the ones where I can expand my business, which are the new conversions that I should target during the campaign. And if
Hmm.
this awareness is percolating across the organization,
Hmm.
okay, from a brand manager level or to SBU head level
Hmm.
from the top. So the outlook is that I have got, say, 1,500 doctors who are currently prescribing my brand, and
Hmm.
the average brand return is X. Okay. At
Hmm.
the end of the campaign, I want the expansion from these doctors because they are giving me either a share of prescriptions or they're
Hmm.
writing an indication where they're not writing enough. Okay.
Yeah.
And I
Yeah.
want to expand that. So that numerically should translate to X. So then my monitoring becomes more effective.
True.
Second set of doctors are the doctors who have already been primed but have not started prescribing or not contributing enough. They may be giving you few, but definitely they are aligned with your, company, with
Therapy and
your field
policy.
force, and also with the brand in some
True.
manner. So
True.
those 3 or 4 identified customers out of these, which you want, which the field says, no, I'm going to convert with, for this in during this campaign, that needs to be enlisted and monitored.
Absolutely. The
So
KPI
that
really matters. I think the point what you have told Sriram sir is basically the preparation, execution, and tracking. And the one important thing which you brought out is the use of tracking this using technology, be it your SFEs and having key metric areas. So commonly, Sriram sir, what we have been listening from many companies that we work, that the attrition is very high. And as pharma companies, we all, be it small or big, we are dependent on our field force, which is the medical rep. So, what is the importance of reaching out the right set of doctors? How do we validate? So, if I am a medical rep, I'm based in Hyderabad, I say that these 100 doctors are very important. And you sitting in the head office, how do you validate or do you go by what I say?
hello. So Ashish, see,
Yeah,
you're talking about first is attrition. Okay, attrition is a phenomena which is going to,
continue.
continue. Okay, because we are talking about, I mean, it's a large chapter in MBA that we learned.
Yeah,
Building aspirations, matching the aspirations of the company and the what do you call
field.
it, employee. Okay, so we're not talking about attritions only in field, also in the head office.
Yes.
However, what is very important is that irrespective of it, you have to set some realistic expectations.
Mhm.
Okay. So if somebody says that my campaign is going to be 100% implemented, I mean, that's a mirage that we have lived through. Okay. It doesn't occur. But coming to tangibles, that is where the data is very important. Second very important thing is that in case, like for example, let us say that I plan to, I mean, in our day-to-day planning also, I want to take a road to go to Colaba. Okay. And there's a traffic jam. So I can be either you can be stuck in a traffic jam or you find out another route which will actually reach you to that place where you want to live. So what happens is that layering in the pharma industry is one of the most beautiful things where we have managers and layers sitting over there. The campaign can be instantly modified and transferred to the next line hierarchy, not to the next step, the next line hierarchy to at least ensure that the campaign doesn't break down during that particular phase.
Perfect.
Second thing is that in terms of digital resources, if we have that in hand, at that point of time during the campaign where there is an iteration, okay, at least what we do is we hold the resources back, stop the campaign, because the campaign, the resources they are spent, the campaign anyway becomes ineffective because it has not been well worked out. In that phase, you actually continue to do a digital campaign just because you want to be part of the ongoing campaign, and at least doctors are beginning. The conversions may not be as effective, but then
True.
that's a realistic expectation.
True.
Okay. But the resources, if they get spent, many times what happens is the resources go to the end mile. Okay. They sit in one place for a long time. They're not
Hmm.
retrieved.
Hmm.
Okay. And they are not given to the next rep, new rep, which comes in. Okay. Who on his induction could also run the campaign to get the same effective or get the results. So some micromanagement is very important if you want that, we have to overcome this practical issue. It's a practical
Absolutely
issue, but we need to be sensitive to the fact that the resources should not get wasted at that point of time. The
true.
campaign continuity, which is there in some format, is maintained in those vacant areas.
True.
However, once the vacancy is filled up, the campaign is conducted so that it is also adding to the original objective of brand building.
So I think, well, points have been discussed, and we understand the practicality as well as the challenges which are involved in executing. So there are questions which are coming up in the chat. We will definitely taking it up. By 1 o'clock, we intend to complete the session. But
Yeah.
from 1 o'clock onwards, we have requested Sriram Balasubramanian sir to be there with us for 15-20 minutes. And these questions which are there in the chat, we will be taking it up so that you get the best value from the session and the time that you are investing with us today.
Sure.
The second question which is coming is basically what are the engagement metrics as pharma marketeers need to track return on engagement and consequently prove return on investment to justify their marketing spend, because end of the day it is not about designing a campaign as what Sriram sir was trying to say. The challenges lies in the execution, efficiency, and the consistency at which we are able to get the returns. So with that, Sriram sir, can you share us some practical example in terms of what are the engagement metrics that pharma marketeers need to track?
So, so Ashish, first, most important thing is that for each and every brand, okay, there are certain common sets of, return on engagement that can be always, set. But if each brand is unique, what I mean, every brand has its DNA. Even if they are in a clutter of, you know, uh, brands which we can call a generic clutter, okay, your brand is always unique. Your brand has got its own DNA,
Yeah,
okay. And with that, when you designed the brand to be launched, or you designed the brand strategy, and you're integrating your campaign along with it, you need to decide what are the measures, okay, which you will say now the customer is engaged. Let us say, for example, in your engagement of the customer, the objective is what? The objective is finally to see to it that there is a growth during that phase. If you look at the classical growth in that, but for the growth to come, the growth of engagement is very important. Like that is a doctor who spends very little time when the rep goes on an ordinary day,
true.
actually starts giving more time to the representative or the manager when he's visiting him. So let us say there is a pre-campaign activity. We should be able to actually measure that during the pre-campaign activity, whether the doctor was really interested in that nature of, the activity that you're going to undertake. Okay. Whether all the, what is his current with a good RCPA, you actually also understand what is his current trend. You may have data which you collected during the course of, many months before, during when you updated MCL. But when you sit down before the campaign, also you can take a fresh update. What are his habits? What are the competitors who are standing in front of you? Also try to find out what are the campaigns which other companies have actually carried out in the same segment or in the same molecule level, okay? Because you already know your enlisted, what do you call as competitors. Try to gather some market intelligence. Without that market intelligence, you are not really preparing for the ROE, because based on that, you will be able to on the go fine tune, okay, your campaign, and constantly before the campaign starts, whether these things have been understood by your people and understood at the head office level. So we know that what we are going to carry out already, whether it is engaging enough compared to somebody, compared to the expectations of the customer. So when you're entering the campaign which you designed and you've given a circular saying that okay, go to this first visit, you discuss about a particular point. I've given you a tool to discuss it. Okay, using that particular tool, finish that particular activity and come back, and then you see whether the product availability is there. Then again, you go for the next visit. Again, you try to do a brand reminder, then you do a brand. Typical campaign cycle follows from engaging to reminding to results. So in this particular phase, the engagement of the doctor could come in various ways. It could come in by doctor agreeing with you, a doctor disagreeing with you, doctor asking for more information, doctor not being interested at all, or doctor wanting more than what this campaign activity is all about. Okay. So we know that the pharma marketing has these elements. So all these elements, if the brand manager can actually plug in into the SFE for the feedback system and make the team understand, if sales team is very important, most of the time we don't buy them in. उनको लगता है बहुत काम दे दिया है, बहुत फॉर्मेट दे दिया है, बहुत भरने को बोल दिया है, अब इतना काम कौन करेगा, हम तो डॉक्टर मिलेंगे. So I'm sorry, I'm spinning off into Hindi, but point which is there is that we need to also understand that when they buy and understand that this is going to actually help them to earn their incentives, it is going to help them become, improve their sales excellence in terms of brand performance. It is going to be rewarding to them. And that reward, when it gets, that gets into the person's mind, then automatically you see those centers of excellence coming up. I don't saying that all the entire field force that you try to motivate is going to fall into the place. But step by step, when they see others perform, one campaign hits effectiveness, and say a certain set of people in the team, let us say out of 300 people, say 100 team members actually perform well, the others will join the force with every successive campaign. So from my point of view, it is very important that these ROE measures are built into not just the ROI. कि मेरे को 300 यूनिट का प्रोडक्टिविटी चाहिए, 300 यूनिट का प्रोडक्टिविटी इज not going to come just like that. You have a base of 200. Your campaign wants an increase of 100 strips. Okay. So for that 100 strips to happen, you really actually need to know whether the customer has got properly engaged, whether he has, come to a point where he is ready for, increasing his prescriptions. But to do that, his status has to be known. You have to remedy it during the next 2-3 visits that you're planning. That maybe it's an objection, let me handle it. Okay. Maybe it is that he's not actually engaged in this with the activity. Maybe my preparatory work was poor. I can repeat it. People don't think that they should not repeat it. I can repeat it. Sir, maybe last time I've engaged with you, maybe you were not. It could also be that during that phase of time, doctor is, not really involved because of other reasons, not because we are effectively presenting. But once it is measured, we should work on it till the campaign effectiveness improves. And then you can start measuring, okay, the ROI that is required. Because then you can know that if the doctor is really engaged, he has the potential to write 20 strips. The other customer has the potential to write 30. The others are going to give you 10 strips each and so on and so forth. So the whole measure will take place in that particular fashion.
Yeah. So a real example that we would like to share as agency, we have worked with a pharma company where we designed a loyalty program, a trade loyalty program. A typical investment for that activity was around 10 lakhs. And the engagement metrics which the company has set up before starting the activity was how many chemists are we enrolling into this activity by spending 10 lakh rupees. So we were talking about 5,000 plus chemists, which has to be enrolled into this particular activity. After this 5,000 chemists, how many are active chemists? So we are talking about 3,500 at least should be active, which is 70% of the total activity. And then how many people are actually purchasing your brands? So this was the 3 engagement metrics which we had set up. And over a period of time, we got a feedback from customers saying that we wanted to understand what exactly is their repeat purchase. So this was one more very practical feedback which we got from customer saying that what exactly is the repeat purchase. So end of the day, after we did that activity, the business impact was basically what was their sales and how exactly their availability has improved. So across that particular counters, we have seen that their share of wallet compared to competitors have definitely increased. So this is a way which probably we have been able to help companies to measure their return of engagement. And the points what you have shared with us are also practically concerning as well as important for pharma marketeers to implement while designing the campaign itself. It is not only about designing, the person who is actually executing, understanding, accepting, which is your doctor as well as the MR, should be in alignment to your campaign. And whenever campaigns go wrong, it is very important for us to do a course correction, as what Sriram sir is trying to share with us. So with that, Sriram sir, we also wanted to understand with you how pharma marketeers are approaching the puzzle of targeting. So when it comes to targeting, pharma brands intend to reach out to the right set of doctors, chemists, and the market. Market, we are talking about the geographies. As you said, we are sitting in India where every state behaves very differently, and the approach which you may have to take sometime has to be region specific. So coming to that, and also concerning the area of pharma marketeers, is how can prescription generation help in improving ROI? So there is lot of effort when it comes to prescription generation with regard to therapy or molecule relevance to the particular doctor, the doctor prescription habits, the demographic and psychographic of the patient who is coming and meeting the doctor. So keeping all that in mind, please guide us in terms of how can prescription generation help in improving ROI?
Uh, Ultimately, prescription is your money.
Yeah,
If you in single word,
yeah,
that gets translated. But prescription which is not honored is not your money. Okay.
true. Very
So
well.
pretty, I think, according to me, to the extent of 20, 15 to 20% of your business loss is because
Hmm.
your prescriptions don't get honored.
Hmm.
Okay. Also, the distribution of your, products at the retail level,
Hmm.
okay, is not aligned to support the prescription servicing that is required. Generally, what happens is that, let us talk about regular 2, 3 activities. One is launch of a product. So people make the availability based on a doctor list saying that these are the chemists where the prescriptions will immediately hit, and that is sufficient for us to at least engage a doctor. Second
Certainly.
is that, but also during this particular launch phase, many times when a doctor unleashes and he starts prescribing, he prescribes beyond the geography which we have imagined. He prescribes sometimes a quantity which we have not well estimated. And then the logistic support to serve that prescription is somewhere insufficient. And the doctor then comes back to us and says, availability nahi hai, mera patient नाराज हो गया.
True.
Don't you know that when I write a prescription, it should be available here, it should be available there.
Yeah.
Okay. Some of them say that you should know where you should keep the stocks. It is not the prerogative. My patient should receive the.
Hmm.
So many times during launch also, many of things, the activities in terms of preparatory work should focus on ensuring that there is a quick logistic service to honor these prescriptions because they are revenue. And also the dishonoring of prescriptions also lead to customer dissatisfaction and hence loss of business. Okay. Same is true also for campaigns. So when you talk about prescription, that's one part of it. So with and that's where Ashish, I think your organization kind of tries to keep on reaching out to the retailers and try to tell them that these are the products which are now on an active mode and they need to be engaged with that particular brand. But important part is that it is not only your job, it is a job of the organization
Yeah.
of the team to ensure that this particular prescription dishonoring doesn't take place because it is their effort. They are putting a hard work. They are putting in their energy. They are putting in their resources. They are putting in their money. Okay.
True.
And that money is lost if you're not able to really take care of this. So
Hmm.
prescription honored is revenue. Now, second thing is that, once prescription comes, technically, okay, we understand prescription coming from loyal doctors, okay,
Hmm.
which but always we try to build our KOLs and KBLs in such a way that they have a loyalty index. There is a steady business which is coming in. But once it becomes a pen habit, okay,
Hmm.
the prescription is like in a cruise mode. You know,
Hmm.
you are able to continuously get business from the doctor. And that's exactly what every marketer wants to achieve.
Absolutely.
Barring, of course, competitive activities which could derange you, or your own inability to sustain that prescription because you have not carried out or given importance to that prescription that is flowing in. So this is one part of what I would say prescription,
Mm.
uh, you know, first stage of prescription honoring we have to look into.
Very
Now
good.
we talk about prescription by itself, and which is an important debate which we keep on having. So many marketing agencies coming in talking about prescription data.
Mm.
All the marketing team and product management tries to engage and look at the prescription from the point of view of, how they have picked up the data from doctors and classified it, and whether it is going in the usage is in a particular specialty, whether it is in a particular indication, whether it is what you call as in geography, and so on and so forth. And these are based on sample size, or these are based on actual data, okay, non-extrapolated or extrapolated data, and based on which a lot of inferences being drawn. But my humble submission is that we are the ones who are closest to prescriptions as an organization than anyone else. We
Absolutely.
need to teach our people to not only just go to a doctor with chamber without putting in time to study prescriptions.
So I
Because
think
the
the
live
alternate,
prescriptions are
yeah,
live prescriptions are hitting the retailers at all the time. Only
absolutely.
thing is it requires a very planned and clear understanding that if I want to understand the doctor, I should understand his prescription.
True, true, true.
And once I study his prescription, I can see patterns which are beyond what the agencies are telling me. Of course, they are important. We need
Mm.
to use mass, or what do you call as data, so that
Mm.
we are in a position to at least get some alignment. But very important is for the rep, for the manager at that point of time to study his doctor and his prescription is the most important science that we need to teach them.
Absolutely.
When they,
So I think
when, Hmm.
the alternate channels of availability. So we have been helping pharma companies to make the brands available, excite the chemist to stock and sell the brand. There is definitely resistance from the chemist when it is a new brand because he would like to see the prescription before putting his money on the game and stocking in because they are inventory concern, cash flow concerns, confidence concern of the chemist for not stocking your brand.
Correct.
But yes, they has to be equally available. Otherwise, your doctor engagement is at 1,000, and among 1,000 doctors, let's assume that 800 of them has started writing your brand, and among 800, if only 400 prescriptions are getting honored, then let's understand that the ROI is purely on the RX fulfillment, as what Sriram sir is telling. It is not only on the prescription generation, which is definitely the start of the business. But if RX is not fulfilled across your traditional channel or online channels, then there is a leakage, there is a substitution. Very few cases there may be a substitution, but there will definitely be a bounce prescription situation, which we as marketeers would definitely not like to see. So the importance of availability is what Sriram sir is trying to tell us. With that, we have a follow-up question to you, Sriram sir. So we are talking about chemists, right? So
Yeah.
when chemist availability is improved, right?
Mm.
Do you feel this will directly impact the ROI?
Obviously, but when we say availability, then it is also important that, as you rightly pointed out, Ashish, why are the retailers resistant? Okay,
Right.
because technically retailers are resistant for the simple reason why they have, in India we typically have, the generic brand
Hmm.
bandwidth.
Hmm.
So the overall what do you call as inventory of various brands that they keep, they want to optimize it. So they're
Hmm.
not very sure that the investment that they put in, okay,
Hmm. Hmm.
will, they will be able to liquidate it appropriately and will
Hmm.
be able to realize their, what do you call as investment in the stocks that they have put in.
True.
Second is that when you say that you are going to keep my stocks, okay,
Hmm.
I engage with you, I, convince you. But on keeping it, if I don't take the responsibility to liquidate it,
Hmm.
then this next engagement that you're going to do with him is not going to give confidence. So retailers generally will believe only in the field worker. Okay.
Right. Right.
who has got the responsibility for what he is actually,
Hmm.
telling the retailer. Because that if I make so much of stock available, I have to ensure that the liquidation pattern is, that is where the whole disconnect is. And that is the reason, okay, when we get into this thing, and so we can run campaigns, we can inform them, okay, they may be aware at least, even if they are not stocking. But again, if the prescription is hitting that particular retailer, and it's very simple. We used to do this when, in our erstwhile days. When we used to run campaign, we always had the retailer's number available for
Hmm.
during that campaign phase. We know these are the 20 retailers
Right.
or 30 retailers around which, the prescriptions are going to. I know out
Okay.
of that, 10 have stocked. Okay.
Hmm. Hmm.
Others just have some limited stock available, and
True.
some who have not stocked. So this was the pattern, and this is the pattern even today.
True.
Okay.
True.
The most important thing is that after doing an activity, my constant follow-up with the retailer, whether really
Hmm.
prescription has been generated. Secondly
Hmm.
is priming stockists, because we know that depending upon the area, there are areas where there are multiple stockists which are visiting. There are areas where there are, limited stockists which are visiting. Where there are multiple stockists visiting, there are some who are, eager to serve. So when we know this particular pattern, we should ensure that as soon as a prescription hits, okay, somewhere we get a message.
Hmm.
I have not stocked it, but I've got a prescription. I want to honor it. It is
True.
interest on both ways. If you are interested in calling up the guy and asking, "अरे आज कुछ आया क्या?" Yeah, you reach out to him, visit him and say, "क्या हुआ?" And then say, "नहीं आया sir." You go back and immediately see to it that the prescription, how we are generating that prescription. So he becomes very confident that you're totally involved to ensure that the business is conducted. We are in business. We have to conduct that business and ensure the business takes place.
Hmm.
So when
Hmm.
you look at, people who are having very high productivity, excellent salesperson, okay,
Hmm.
every company has that. Okay.
Yeah.
Every good company has got, brilliant salespeople. These
Hmm.
people are constantly worried that their business loss should not take place.
Hmm.
And they are engaging with the retailer.
True.
Only thing
True.
is, we need that awareness to flow from down to above so that there is more uniformity that we can bring among
Absolutely.
all the other,
Hmm.
regions where such success is not seen.
So you're talking about two things. One is trust. The chemist is actually trusting not on your brand, but first on the person who is actually getting your brand. Second is accountability of the person who makes sure that yes, the business will get the RX will get generated and your stock will get liquidated. And if situation go wrong, then probably expiry and return. How you as a rep or the company representative are responsible for not risking this out for the chemist, but helping him out in terms of expiry and returns. So that is
Ah,
another area which may be some of the cases where we as pharma marketeers should also be vigilant about because this chemist, you have to interact with him for your next launch as well.
absolutely. So he's a partner to you. We cannot, dissociate him कि मेरे लिए availability कर देगा, फिर
Hmm.
बाद में. And one should not forget, many times I've seen,
Hmm.
because of iteration, somebody leaves that territory. मैंने तो
Hmm.
माल available करके दूसरा company join कर लिया.
Hmm. True.
But the point is that you're forgetting that was he's still your partner for life if you're in this
Hmm.
profession.
True.
He will remember that last time you have not done your job correctly,
Yeah.
and you're
And
not
he
going
will
to get that
take it
assistance.
to heart.
Okay. So if you think he's a partner, then you should help him. And as you rightly said, expiry breakages. Okay. If I keep on discussing with him about non-moving things, get
Hmm.
some things to move. Some things may
Yeah.
not move. Okay. That could
Yeah.
also happen.
Yeah.
But I get the stock returned to my stockist well on time.
Hmm.
Okay. And it gets redistributed. Automatically pressure,
Hmm.
okay, reduces.
And his
The
confidence builds
retailers,
up
the
automatically.
confidence gets built up.
Right. True. Absolutely. So with that, we just move on. We have a limitation of time because Sriram sir has told that he will be there with us to do a justice for the session for all the points that we wanted to discuss with him, as well as the questions for the very first time. We are having our chat, which is buzzing with questions. So Sriram sir, we will definitely hold you for a while till we get some clarity and our answers are taken care of. So coming to positioning, which is all about communication and how you actually take your brand to your target audience. So as pharma marketeers, we design beautiful creative campaigns. How do we measure ROI using digital modes of communication? So now we are talking about in the digital era, AI era, where people are using various tools to collect the data, measure the data. So you have worked across various roles in your organization. So can you please give us some light in terms of how do we measure ROI using digital modes of communication? So it can be WhatsApp, SMS, email, IVR, or anything. So do you think that it is impactful or this serves no purpose?
No, no. See, digital mode actually is an evolving, um, and I think in the last decade, a lot of things have happened.
Yeah.
But on this, there are two fronts. One is the digital resources which get an auto engagement, and
Hmm.
digital resources which are don't. There's no auto engagement. You have to actually feed
Yeah.
the digital data point so that it starts giving relevance.
Hmm.
According to me, if you are going to use AI and only rely on AI, you may actually go wrong because its
Hmm.
interpretation are evolving at this stage. They have not become, mature enough at this
Yeah.
stage. Okay,
Yeah.
they will attain maturity at some point of time.
Hmm.
But when you're talking about digital engagement, there are a couple of ways we engage. One is a direct engagement. Direct engagement using tools like iPads or digital communication devices, which are used by a presenter to a user. Okay.
Yeah.
Now, in this, there is certain amount of data that can actually get captured, but there are also a lot of resistance in terms of, doctor saying that camera band rakho. Okay, we don't want to be, no, I don't want this, don't violate my privacy. So this
True.
actually limits an, marketeer
Hmm. Hmm.
from actually acquiring data. However,
Hmm.
still they are open to receiving the communication, but not getting screened, okay,
Hmm. Hmm.
directly by the
Hmm.
devices.
True.
But my people who are actually delivering this particular communication, they have now, because marketing has made their life much easier by
Hmm.
pushing in a lot of digital content and which actually gets delivered and updated quite frequently. Their
Yeah.
job should be to improve their observation skills during
Hmm.
such engagement and feed in that data, okay,
Hmm.
after the activity so that the digital enrichment takes place.
Hmm.
Without digital enrichment, okay, this
Hmm.
particular process
Hmm.
will not give enough, what do you call as, pointers for marketers to improve the ROI. Second is we talk about the other things where it is you send a WhatsApp, doctor engages, doesn't engage. So look at the percentage of engagement that you actually had.
Hmm.
Which activity engagement, which activity, which campaign, which communication, which creative. What was
Right.
important about that creative? Okay,
Right. Right.
which actually resulted in a
Hmm. Hmm.
proper response. Which are the ones we did not fail? Pull
True.
out those metrics and try to slice it and
Oh,
dice it.
correct. Absolutely.
Okay. Sometimes
Absolutely.
it is one visual, sometimes it is one word,
Hmm.
sometimes it is one statement,
Hmm.
sometimes it is one data point, which is
Hmm.
actually engaged.
True. True.
So if you are not able to decipher that,
Hmm.
then it is when you flow into the next digital, what do you call as engagement,
Yeah.
you are not really taking all those learnings to that particular side.
Yeah. So, Sriram sir, just to add on what you are saying, if it is a small company, large company, MNC, or a India company, Indian-based pharma company, we all have limitation when it comes to medical reps with regard to quality and quantity. So we can't have an army of people, and our target audience, which are doctors, are huge. We are talking about 10 lakh plus doctors. If you are focused on specifically special therapies also, still we have limitation when it comes to medical reps. So when we are talking about established brands, and we just require a reminder
Mhm.
to the doctor or to the chemist say, hey, this particular brand is still there and it is going to serve the purpose, and this is something which we want your support. If it is an established brand and it is at the maturity stage, do you feel digital modes will make sense?
See, every digital mode makes sense. However, you must
Yeah.
understand that, we are now not only talking about digital mode. If you look at it, we have to do media management.
Yeah,
We are not
true.
doing media management
Hmm.
in pharma.
Hmm.
If you're talking about, online, like you want to do Facebook marketing, okay,
Yeah,
or you're trying to do whatever, Instagram or any other. So you have a media management where you know that what is the right time, what is the
true.
right audience, when to engage. All that we're doing now is just blasting that particular content.
Right.
Whether it is getting delivered at the right time to the customer when he actually is open to engage is something that we're missing in our whole plan.
Absolutely. And right content which resonates to his
So you
interest.
could already we are such a clutter of information flowing in.
Yes,
So
true.
unless media management studies that is what is the right time,
Hmm.
what is the right, what do you call as type of audience to whom this is going to reach out. So it's not a blast. It should be customized.
That's
Then
correct.
you will get engagement.
Certainly, certainly. So we have so you have talked about established brand, right? So we have the last questions for today webinar, which is for new launches. So a lot of companies launch new brands. So as pharma marketeer, you have been in a financial role as well. So how do you measure ROI for new launches? Because wonders will not happen in the first 60 days. So what are you measuring when you are launching a new brand in the first year of the launch?
So actually, when I talk about new products, I divide, my whole launch because again, new launches are also very expensive. Okay. Again, preparatory work is very important.
Mm. True.
Preparatory work uh, starts from research. I think the money spent on research prior to the brand launch. Everybody has limitation. A lot of guys will tell me, Aris, sir, itna to humko, what we get is just an IQVIA data or maybe a prescription data. But I believe that if you're going to launch a brand manager has wherewithal to reach out to customers whom can be KBLs or KOLs in that particular segment, okay, to drive that particular brand. And when I say that, you know, it is not that, across geographies, across areas, because it's very diverse, we will have different types of KOL, KBL behavior, which will come in when you actually do a research pre-launch with them in terms of what their expectations are. Most of the time, doctors keep on asking me, you bring a brand to me, okay, you want to promote it to me, okay, this is wonderful. Give me the place in therapy. And I keep on telling this very clearly because I think many other people are there in this seminar also who are attending. Doctor asked me, tell me where to write. And
True.
where to write is not just an indication.
True.
Where to write means where is the space in my prescription to write your brand. It could be as a prescriptive, it could be as a co-prescriptive, it could be in an engagement point where he is practicing. It could be many of those demographic elements where he's saying, मैं
Hmm.
अस्पताल में लिखूंगा लेकिन ट्रेड में नहीं लिखूंगा मैं यहाँ लिखूंगा so he's trying to ask a question because he's asking whether you've done your homework when you're coming to me.
Hmm. Well said.
Okay,
Yeah.
so
Yeah.
having done that and when I take out that data point, then I develop a launch plan.
Hmm.
Okay, a launch model. I wouldn't even call it as a launch plan, a launch model, which is
Hmm.
customized, which I can deliver to my team and tell them, boss, this is where I think you should focus your brand on because I want to have leadership position within this particular space. I can be a leader as a brand in the entire IPM. I can say I want to
Hmm.
be number one. Very easy to
Yeah.
say.
Yeah.
But to build a house, you don't build it in a day.
True.
Okay. So if you look at a typical construction, you may start with one phase, one wing, start building it. But in that phase, you are started achieving something. Similarly, you should also aim for leadership based on those, slices and dices of segments that you do, where you feel your company has the strength, where you understood the customers properly, and then make it into a marketing model. That marketing model, whether it works or not, is the measurement that we should do in the first year. I remember that when in the days of ORG Mark, okay, when Mahesh used to lead the team, Mahesh Kelshikar, he used to come and present us 12 months data. Well, that's when I said 12 months data is insufficient. New brands need to be measured for 24 months.
Is it? Okay.
For the simple reason, most of the time, the MAT data of IMS ORG, and currently everybody is doing a 24-month data.
Yeah.
Largely because sometimes it is launched in the mid of the year or the end of the year. Your MAT actually doesn't have a 12-month data. In the 12-month data also, okay, what you're achieving is you're achieving the perception of the brand with a set of customers who will then drive the next wave for the brand to grow. Of course, there are exceptions. Tomorrow, global brand like Manjaro or, Ozempic, they already have trends. But we are talking not only of those, first-time launches or stuff like that. We are also talking about launches where you are also among the others. So if you're also among the others, okay, you must typically build your grid where you want to have leadership. And in that, once you have decided those metrics very clearly, the approach very clearly, the communication very clearly, you should measure the effectiveness of that. And I think the entire management as well as the effectively achieving that in the first year. Second thing is that the ROI that you're setting, if there are huge spends, obviously you're not going to recover entire money, but still in some cases you have to have the break-even point defined. And that
Certainly.
break-even point, okay, if it is in 14 months instead of 12 months, okay, or it is in 18 months instead of 12 months, you should see whether the trend is in the same direction or not, or what course correction you need to do to get the trend back in that particular direction. So it's a constant learning of correction that you need to do during that particular launch phase.
Great. So, wonderful. So we have got the perspective about how to measure ROI in case of new launches, the important stakeholders, how they have to be engaged, how they have to be tracked, and how to take consistent feedback. Various points which has been shared by Sriram sir, which need to be provoked at your current situation, and you need to really work on this particular aspect. So with that, we come to the end of the webinar discussion, and we are definitely having so many questions to be answered. So we'll pick up few of them. And Sriram sir, with your permission, can we share your email ID for people to get connected with you, your LinkedIn profile, so that people can continue their learning journey with you?
Sure.
Yeah, great. So, team, can you please put the email ID and LinkedIn profile of Sriram sir so that people who would like to connect with him personally can do so. And there are certain questions which definitely is coming up in the chat. Before that, I would like to announce the two speakers for today's session. First speaker who have answered the fastest. There is no right, there is no wrong answer for the self-audit activity for ROI in pharma marketing. I'm sure the two speakers, along with the other speakers along with the other participants who have given their energy towards this self-audit activity, has got some perspective about where do they stand currently. The first winner for today session is Mr. Bharat Mohan, and he is joined us from Mumbai. Congratulations, Mr. Bharat Mohan. And the second winner for today's contest is Mr. Shiva Kumar. And Shiva Kumar, we don't have his location, but congratulations to both of you. Team, can you spotlight Mr. Bharat Mohan and Shiva Kumar? Thank you so much for joining, and congratulations. My team will reach out to you to take your address. Please be patient with us because we are dependent with the publisher and with the author to release the book. And trust me, you are the first people to get the hard copy of this book, which is from Subarao sir. So Bharat and Shiva, congratulations. And with that, we will continue with our remaining part of the session. And also, we'll take a couple of questions because time is a limitation that we have today. With that, we will We will also appreciate your feedback on the session because there is a lot of time and energy which our team undergo to do this kind of webinars, which are of use not only for our participant but for the industry and for ourselves to understand the industry better. We would like to hear from you in terms of how exactly the webinar has delivered to your area of interest. Please scan the QR code, or team, if you can drop in a link, people can please give us a feedback. I would request all of you to give us your honest feedback in terms of the quality of content and the relevance of content to your area of practice. So coming to Medgini, there have lot been people who are asking about what Medgini does. Medgini is an agency based in Hyderabad and Mumbai. We are serving pharma industry in terms of awareness, availability, visibility, and mobility solutions. So we are serving large pharma companies, large brands in terms of taking their journey for chemists, doctors, patients digitally. So there is a lot of services that we provide, and we will be happy to reach out to you if you have any areas that we can work together for your brand. Please reach out to us. Our team is available in Mumbai, Hyderabad, and virtually anytime, anywhere for you. So with that, we come to the end of the session. And Sriram sir, on behalf of my team, there is a token of gift that we would like to give it to you for your time, which is a book from Subarao sir, which is Advertising in the Age of Generative AI, which is definitely your area of interest as well. So please accept this particular token of gift from our side, which will be delivered couple of weeks from now. Yeah. So
So thank you so
I'll
much.
take. Yeah. So on behalf of Sriram sir, also, I would like to thank all the people who have been there with us. And the ebook, which will be given to all the people, it'll take a week from now because we'll be crafting the conversation which we have today, and we'll be sharing across to your email ID, which is registered with us. Yeah. So we'll be taking some questions, Sriram sir. Will that be okay?
Sure. Sure.
Yeah. Thank you so much. Great. So we are talking about many questions. So
I saw a
one,
lot of them
yeah.
actually popping up
So,
all the time.
so Bhaskar says that can you help me think in a direction that I got an idea on the availability for the new launch or a campaign initiation. We can collaborate with e-pharmacy healthcare, especially in the new launches. This can help improve product accessibility and ensure. Okay, I'll take one question directly, which is coming. Shwetam says, what has to be done first, RX generation or product availability? It's a chicken and egg story. Does it depend on high involvement or low involvement product? So, Sriram sir, let's take two examples. One, high involvement product. When we talk about high involvement, what I understand, Shwetam, is dependency with the doctors, or the cost of the therapy is very high. And low involvement product may be acute therapy, where we are going to focus more on product availability than on RX generation. So I think your question is more towards acute and chronic. So Sriram sir, you have worked in both the areas. Can you give us your perspective whether we have to focus on RX generation first or product availability?
So I think I have also understood the question in a little different perspective.
Yeah.
Okay. Perspective is the first part, of course, talks about chicken and egg. The second part talks about whether, a product which is in high engagement by marketing or low engagement by marketing. Okay. So I will
Yeah.
divide it into the answer according to what I interpreted. So when we are talking about prescription generation and availability, I clearly, when I communicated, I have to be the watchdog. Okay. And the watchdog not at the rep level also, because the minute I know that the retail is cooperative or non-cooperative. Okay.
True.
Just like there is consumer behavior, there is a customer behavior. My customers are two very important customers. One is the doctor, his behavior, and the retailer, his behavior.
Hmm.
If I don't classify and map him, because all that we do in an MCL is pick up उसका नाम क्या है, who is the salesman, उसका क्या number है, क्या address है, क्या pin code है, and which are the doctors here connected with. Finish.
True.
But we are not mapping the customer behavior. Okay. If he is really service oriented, non-service oriented, okay, whether he's, chemist who says कोई भी brand हो मेरे पास होना ही चाहिए, is a chemist who says that I will wait and watch on the sincerity of the rep and then take a call on it. So we need to capture, and it's not an easy process. It's a process that will constantly improve my database in terms of understanding. So it has to come from the ground level. So when I am very clear that this is the nature of retailer and the doctor is very important to me, I will design a tactic, not a strategy, a tactic to ensure that this particular prescription generation or availability is kind of well balanced.
True. True.
Okay, the doctors will give you prescriptions just for the sake of helping you to make the availability.
Right.
And the doctors are going to tell you, make the availability, then come to me. The point which is there is that is where your real engagement with the retailer, your sincerity, his trust has to be won. Okay. And if that tactic is taught to our people, we say that, today medical reps, we talk a lot about, the quality of reps, and we talk a lot about, I still believe that they're also part of the same, the new generation, which is smarter than others.
Certainly.
So the first step that our assumption that they will not, learn enough, I think it's very wrong. I believe that they're willing to learn, but we need to understand their language and deliver it to them so that they understand the importance of it.
True.
Their knowledge and skill sets may vary, but it is very simple. Okay. If I want to teach somebody to, ride a cycle, the first thing that I teach him is to balance.
True. True.
I don't tell him to watch the road. Okay. Idhar kya ho raha hai, udhar kya ho raha hai. I focus him to what needs to be replicated every time. So if we can bring that element, okay, then we can teach him how to engage with a retailer in such a way that he understands the retailer. He plans this balance between prescription and availability.
Certainly.
That is one. Now question is, highly engaged brands and non-engagement brands.
Yeah.
At a rep level, okay, it is a dependency on which brand determines the whether it is a high engagement product or non-high engagement product. Let us talk about, any company you take up. You may have a hero brand or say 10 hero brands. But when you go to a territory level, it is varying. Somebody may be selling legacy products. Some may be selling some products which others are not selling. For him, it is the most engaging product. So from my point of view, what the marketing wants the rep to get engaged into at the last mile is an effort that you do, even if it is not a very engaging brand or not such a priority brand, but for the rep, it is very engaging. And if the availability or the prescription generation is not sufficient, he is going to lose incentives.
Certainly.
So while I want the overall plan of the company to get, implemented, I also cannot cut off the route, because in such cases, it is going to impact his earning and hence increase the iteration level for the company.
Certainly. Perfect. Got point taken. And Sunil has got one question for you. So he says that doctor is ready to prescribe. However, chemist asks for non-viable schemes for product availability. And maybe Sunil is coming from a background where the company would not like to give any offers and schemes to the chemist. That's what I understand from the question that he is saying. In that entire scenario, what Sunil says that this is leading to non-availability of the brand and prescription bounce. So what has to be done? Do we have to be patient till the time chemist gets the confidence that yes, this company will not give any offers and schemes? And are you okay to lose the initial prescriptions? What has been your take on it?
So first thing is that, you should decide what your company wants. Okay. Choose the doctor accordingly. That's where your first mistake takes place. We are thinking that you're choosing a doctor who has got the potential to write. But you're forgetting that there are two sides of the coin in prescription generation. A willing doctor and a willing retailer.
Chemist.
Okay. If you're a company which doesn't want to, only select those kind of doctors and those kind of retailers who are going to only not ask for, I'm not saying schemes, unreasonable schemes. Okay.
Right.
Then in such case, you have to make a pair. Your entire survey, when you're preparing a master list, has to have both of them together. Then you will not fault in it. Because you're speaking about a large doctor data pool in the country. Different behaviors, as I told you. You choose what you want rather than, you just engage and then realize that I've done a mistake. Second point which is there is that in some cases, doctor is very good. 40% of his business, depending upon the amount of business, which is actually served by a retailer, you can also take a call.
True.
The retailer across or the retailer within the doctor's practice zone are two different types of retailers. There's a retailer who's sitting with the doctor. That means the doctor also wants a scheme, okay, for his retail, because at the end of the day, the retail is and business for him.
True.
So he is looking at it as a business point, and he's hence allowing the retailer to engage with you and ask for certain discounts because he wants to ensure his ROI. It is his ROI.
Yeah.
Now, in that case, you know that whether he's the right doctor for you or not. Okay? Because you may not be as a company able to deliver the ask.
True.
However, there are, doctors who are ready to prescribe. They are interested in, their pattern of business is different. And there is a retailer across the street who is controlling, say, 40% of the business. But 60% of the business is also being served by other retailers. Have you really identified them?
True.
And in such case, you can still engage the doctor to tell him that these are the counters which will serve your prescriptions.
Absolutely.
And
And
I'm
we
not
are
in a
talking
position.
about e-pharmacy, quick commerce, everything now. Patient is having the flexibility of going and buying this, searching this on the internet, and taking the door delivery at his convenience. So there are a lot of new age where we as pharma marketeers should be vigilant about in terms of making the product available. So one example I would like to add, Sriram sir, there was one company which did a trick of mystery shopper. So what they did is that they got the prescription from 10 different doctors and they alternatively showed this to they pretended themselves to be patient and they showed it to the chemist. So again and again, the chemist is seeing the prescription of the new brand. And after a week or 10 days, he realized that he is losing business. So after 10 days, somewhere deep down, he understands that the company may not be giving any offers and scheme, but I'm losing business every day. And it is not becoming commercially viable for him. So he ordered the medicine at the 11th day. So this is a trick. I don't know how viable it is, but
And then it is being done in the past also. We, when you look at a typical marketing during launch, every company has set of doctors, whose spread of prescriptions is across a particular zone. तो उनको रिक्वेस्ट भी जाता है सर आपका प्रिस्क्रिप्शन सब जगह पे अवेलेबिलिटी के लिए थोड़ा हेल्प कीजिए तो द डॉक्टर्स आल्सो अंडरस्टैंड दैट इट मे नॉट गेट सर्व्ड बट देन दे आल्सो keep the reps number with the patient to say that in case you don't get it, you can just call him and he will ensure that, you're getting served. So there are such activities which are carried from time to time. And on the e-pharmacy side and the digital side, yes, we always should have the option available so that we can inform the doctor. Okay. But you can make it even more effective. Okay. Through some other engagement activities by means of which when a doctor says that, it's a new product, it's available. Okay. However, if you have any problem, this is the QR code that you can take and scan it and, you can hit the site and it is available in case you find it. Now, what really happens is when this complete discussion doesn't take place, doctor gives a prescription and he is not informed that there will be difficulty in getting that particular product only from certain areas. But we have a solution for you. When that communication is not complete, that is when the relationship takes a beating.
Well said. Well said. I think there might be certain questions which we'll not be able to take up completely, but I would request all of you to continue their learning journey with Sriram sir. Get connected with him on LinkedIn. He is definitely there for you, and his email ID will also be shared to all the people. And all the people who have been there with us, the ebook will be given to you by end of the day. The two winners will be contacted by our team, and you will be getting in couple of weeks the hard copy from Subarao sir. And my team who has helped on the back end, Jayashree, Anusha, the tech team led by Surya. So on behalf of them, we sincerely thank for your time and for the energy that you have shown to us. It has been for the very first time that we have seen the chat has been buzzing. And I really appreciate your time being Saturday. You have spent so much with us. Sriram sir, your knowledge is incredible. And I think this has created an impact to all the people who have spent their time today with us. Thank you so much. Really appreciate to host you today.
Ashish, in case you have the questions which still need to be responded, you
Yeah,
can make a summary of it, and you
sure.
can maybe find the appropriate answers to them. If
Yeah,
they can all be made into 4, 5, 6 questions, which can be
certainly.
summarized. Because I think there are a lot of, if they required, I think that will be something that you can add in your ebook and then send it to them if required.
Great. I think it's a good idea. So, Darshi, please take a backup of the chat, and we will park this to Sriram sir, the questions which are being asked by the participants. And we will encapsulate this in the ebook so that people can definitely take this learning forward. And there is no questions which are not answered or they are not able to reach out to Sriram sir. So, there is no ifs and buts. And we are able to hear to address to all your queries which you have raised today. So thank you so much on behalf of the team. I appreciate your time and looking forward to host you again next month. The topic for the same will be shared to you shortly. Please do participate. We're looking forward to see you again.